Well, hello and good evening. Welcome to this live streaming from the digital platforms of the Tribune network. I'm Rohit Bhan. We are discussing a big story, the spike in number of cases or COVID cases in Punjab. In fact, across India, there have been several states which have reported increase in COVID cases, Maharashtra being one of them, Kerala, and also Punjab. The Union Health Ministry has issued, guidelines to these states on various factors on how to control the spike in cases. I'm joined by my senior colleague and Punjab Bureau Chief, Mr. Sanjeev Haryana. Sanjeev, first tell us how do you react to this increase in the number of COVID cases in the state?
Well, as the figures speak, the number of cases have really shot up. From about less than 2,003 weeks back, they have come to more than 3,000. Moreover, at the national level, where Punjab, Rajasthan, Maharashtra, and Madhya Pradesh have reported. So it means it has the potential of spreading to other areas as well.
Right.
The health department has issued a warning to the health workers to go ahead and go complete their vaccination in first place so that the remaining people can be vaccinated.
Right. And also, Sanjeev, what is the cause for sudden surge in the number of cases? Has this health department evaluated the reasons for this?
But I think in first place, the immediate reaction and the biggest cause for concern is merely the numbers.
Right.
You see, we had more than 37,800 cases last August, which shot to more than 59,000 cases in September, which was the peak.
Right.
And in the peak, we witnessed 1,954 deaths. And the number of cases came down to 6,754 in January, where there were just 234 deaths. So it means the number of deaths had shot down by about 1/4. So merely if we again have the surge from 2,000 to 3,000, so there's always a fear of the cases rising up again. That is the biggest concern.
Right. And also the casualties. I mean, is that a cause of concern, the number of casualties which is increasing?
There is no sudden numbers to indicate any major surge in the number of deaths as such.
Right.
But since there is definitely a creep in the number of cases, confirmed COVID cases, so it's a warning, clear warning when the state needs to get up and prepare itself.
Right. And as far as the health department, state government is concerned, what kind of steps are they initiating to prevent this?
They have made a very broad guideline. They're in first place vaccinating the health workers, the police, and the frontline workers. In the second stage, the vulnerable group, which will include obese, people who are hypersensitive, who are suffering from non-communicable diseases, they will be vaccinated. As such, they have a complete vaccination schedule. But that's one side of the case.
Right.
The actual matter of fact is that the people need to be more careful. The government is issuing advisories many times. But till the time the people keep distance, the social distance is the biggest casualty in Punjab at the moment.
Right.
You take a trip to anywhere in Punjab, the hordes of crowds are back on roads. So till the time people start taking care of themselves, this will remain a matter of concern.
Also, is there some kind of a laxity when it comes to implementation of these guidelines? Initially, if you remember, initial days of COVID pandemic, the police, the state administration, they were cracking down on people who are not adhering to these guidelines. Social distance was not being maintained. Now you see people in malls, you see social gatherings. There's no sort of implementation on so far as these guidelines are concerned.
You're very correct. And I think it's people who themselves are to be blamed for this. Because it concerns people and is for the people, by the people. Like, if you remember in the initial days, people of the village used to sit outside the villages and ensure that no one from the outside enters.
Right, right.
But slowly and definitely that has moved out. So when people are moving about freely, I think that will remain. Although the exact reasons for this COVID thing, it's not exactly known what's the sudden surge. Like in Maharashtra, they found a new strain.
Right.
In case of Punjab, the health authorities have said that no, there's no cause of concern, there's no new strain.
Right.
But I think the issue will be clear with the coming days.
Okay. And also in the state in Punjab, have they found out some COVID hotspots where there's been abnormally high number of cases? Any these districts?
Yes, Nawa Shahar has emerged as one of the biggest points, like in case of the schools opening up recently.
Right.
The area reported more than 50 positive cases among school students alone.
Right.
So that is one of the hotspots. The state is taking up to study the rest of the places as well.
And also, Sanjeev, tell us about the state of vaccination. I mean, have we achieved the targets? What is there on the vaccination front?
I think honestly speaking, people have apprehensions to get themselves vaccinated.
Right.
Like the health workers in the first place. I think out of 2 lakh 6,000 health workers, 38% have got themselves vaccinated till date. So till the time, and even among the general public, they have apprehensions.
Right.
Like they have fears when they hear about deaths and all. Although health authorities time and again are telling people that they are all baseless, they need to get for vaccinations. I think things will get clear as the things move. Government will have to take more strict issues. Like the government has issued a warning to its workers saying that in case health workers don't get themselves vaccinated, they will have to be paying for the same.
Right.
The situation is emerging. Let's see how the state does it.
But isn't this guide a little contentious? I mean, the fact that you'd have to pay for your this thing, or it's necessary now.
It's a warning, and the health authorities, health workers have also reacted to it. That the government is trying to push it out. I mean,
Right.
it's a developing issue. Let's see how it figures out.
But has the government figured it out how to improve this rate? Is just 38%? Is there any other way they are figuring out?
See, the only other way is a force which the government doesn't want to do. That's why it has just asked them
Right.
that you get yourself vaccinated or you will be charged for the same.
Right. But have we reached a stage like in Maharashtra, Amravati lockdown 2 has, I mean, another lockdown is on. Have we reached a stage where there could be probable, government would be thinking in terms of such harsh steps, or are we still not that bad?
I'm not sure about what the apprehensions, what is being worked at the higher level.
Right.
But I don't see any lockdowns in the immediate future, because if there was a matter of concern, then the schools would have been closed immediately after so many cases were reported in Nawashahar.
Right. And also, I have, when you talk about these schools, Nawashahar incident cases emerging from there, have the authorities specially focused on these schools because the schools have been opened, the regular timings are on? Are they a little concerned that with large number of children going to schools, that could be a cause of concern?
Regular messages are being sent to schools. The school authorities on their part are sending messages to school, and some of the parents on different platforms are talking among themselves and saying that they need to be more proactive, they need to be more careful about their children. And honestly speaking, I have seen pictures of children going pretty covered.
Right. Okay. Thank you, Sanjeev. Thank you so much. So there you have, though there's been a spike in number of cases, Sanjeev mentioned the government is trying to ensure that these kind of numbers are controlled. So far, not as alarming as it's in some parts of Maharashtra, where lockdown has been initiated yet again, but in Punjab so far. But the government maintaining that the social distancing and other guidelines which the government comes out with time and again, those have to be implemented. We'll keep on providing you the latest on the COVID status in the state. You can log on to our website, tribuneindia.com, for further updates. You can also follow us on our social media platforms like Twitter, Facebook, and Instagram. Meanwhile, thanks for watching.